Hi, and welcome to the Psych Health and Safety Podcast. My name is Jason Van Schie, and I'm one of the hosts of the show. The aim of the podcast is to rapidly increase the knowledge and application of psychological health and safety in workplaces worldwide. To help with this, we have regular guests from around the world who are leading the way in this important area. But before I introduce our guest and topic for today, allow me to introduce my co-host, Joelle Mitchell. How are you today, Joelle?
I am moving back into temporary accommodation, Jason.
Woohoo!
Woo! End of February, we were returned to our apartment, and it's taken us this long dealing with the insurance company for them to finally come to terms with the fact that there's quite a lot of work that still needs to be done in there. So they're moving us somewhere so that we're not just constantly having to interact with contractors and help them with stuff and essentially project manage what we shouldn't have to be project managing. So, yeah.
Yeah, so pros and cons, right?
Well, the pros to finally have some progress and some action happening, and the apartment that they're putting us in seems quite nice, and they're giving us some movers to help us move some of our more bulky items. So that's nice rather than, having to do 20 trips in our little hatchback.
Mm-hmm.
But yeah, it just would have been nice for all of this to have happened, preferably before we got moved back in the first place. Yeah.
Yeah. But heading in the right direction finally.
Yeah. So, this all kicked off, I think it was the third week of November last year. So, fingers crossed it might all be over and done with within a 12-month period.
Yeah, who would have thought a little leak in a ceiling would have this kind of effect on your life?
Yeah. So, yep, that's me.
Yeah, well, great.
Huzzah.
Well, let's hope that the move goes okay and you're back into your own home soon and they sort it out.
Yes.
All right. Well, knowing your life,
probably
I'm not going to hold my breath.
No, things will continue to just go wrong.
We need ammunition for the podcast,
we
right?
We do. Yeah, this is all really just a made up story. I actually live a very luxurious life, and none of this has actually happened.
Yeah. Wouldn't that be nice?
It would be nice. That would be fantastic.
Well, look, I'd love to now introduce our guest for today. She has a PhD in psychology and has been working as a chartered psychologist in the United Kingdom for the past over a decade. She sits on a number of national groups as an expert advisor on creating trauma-informed services across the NHS and has authored 2 books on optimizing mental wellbeing in staff and how to prevent, identify and treat psychological trauma. She is the director of the consultancy Healthy You. Welcome to the podcast, Dr. Jan Smith.
Hello. Thank you for having me.
Hey, thanks for coming on. And I can see the sun is shining on your side of the world.
Although it could be snowing and raining by afternoon.
Yeah, one of the benefits, right, of living in the Northern Hemisphere.
Absolutely. Yeah, definitely.
Yeah, great. Well, so great to have you on. I'm looking forward to the discussion today.
Me too.
So before we get into the serious stuff, do you have any favorite podcasts that you like to listen to that you could suggest for our listeners?
Yeah, there's a couple at the minute that I am listening to quite avidly. One is the Brené Brown Dare to Lead, which I think is really, really inspirational and thought-provoking. A Psychologist Off the Clock, which is a lovely podcast to listen to, and Dr. Chatterjee, who just has a range of incredible guests on. I think that for me, that's more a learning, definitely intellectually stimulating. I definitely learn things from that podcast.
Fantastic. Yeah, it's nice to have a good mix of sort of entertainment and education in your podcast.
There's a few
rotation.
Few fans of the Brené Brown podcast, that's for sure, that have been on.
Definitely. Yep. All right. Well, can you tell us all about your professional career?
So I guess it's really varied. My degree actually was in neuroscience and neuropsychology. That's what I started off, and for years worked in addiction before jumping into neuropsychology. So I worked in a neuro rehab unit, and then I left the NHS and set up independent practice. And that's probably where I developed my specialism in trauma, particularly in maternity settings. And is where I really then developed my clinical doctorate interest and also my research. And it was probably at that time that I began to recognize how psychological trauma not only impacted on individuals and their families within healthcare settings, but also the impact that it had on staff. And that, you know, both were the same side, or two sides of the same coin, rather. So I was doing a lot of that work, started to work a lot with staff as well, got into leadership and coaching work. And then a few years ago, I was part of setting up the Make Birth Better campaign in the UK, which is a national campaign that is working towards reducing birth trauma in staff and also families and individuals, and really trying to look at it, how to shift a culture. And I also then chair the parliamentary working group, and I have a research post at Sheffield Hallam. More recently, I've become head of clinical services and wellbeing at Cura Human Factors, which started life off in specialising in aviation, but now work across a number of high-risk industries, providing training and consultancy work, and also do a lot within peer-to-peer and setting up peer-to-peer programs. So real varied, really varied background.
Yeah, fantastic. That's a really interesting combination of pathways that have sort of gotten you to where you are. Yeah. I was interested in the birth trauma side of things, because I guess you tend to think about maternity staff in the hospital as sort of, they're there for these wonderful joyful occasions in people's lives and how rewarding it must be. But then you sort of think about the other side of that as well, for when births don't go so well. I guess you don't necessarily think about what that must be like for staff who have to be part of that and bear witness to it, and sort of even, I guess, participate in it to some degree. So,
absolutely. And I guess, I do a lot of expert witness work around assessing psychological trauma in maternity cases. And I always hold, although I'm there to assess psychological injury, actually nobody went into their career to ever cause harm. But actually you can see how the layers of the organisation they work in almost set it up that they, may be unkind to patients that they work with, or that care doesn't go as expected for a number of reasons.
Yeah, I think that's true of lots of bureaucracies. Certainly not a situation that's just limited to healthcare.
No.
A lot of people in helping professions go into help, and then it's the bureaucracies that kind of like we've heard from Carla Kapanecki and others. It's the regular stuff, like poor relationships at work, or
daily grind,
lack of role clarity, all the normal things that kind of affect people's psychological well-being. Yeah. So tell us a bit more about Healthy You. Is this a solo practice, or do you work as part of a team?
So I'm very lucky. I have an amazing team of psychologists around me. And we all, I guess our work is divided up into three main areas. So one is individual therapy work, so assessments and treatment work. And then we also do the expert witness and capacity assessments within that. For people who are impacted by serious injury, traumatic brain injury, or clinical negligence. And then we do a lot of leadership and executive coaching work. So we've recently just rolled out a leadership program for aspiring heads of midwifery in the NHS. So we do a lot of programs as well. And then we also, the third stream is probably the more mental health consultancy for organizations and wellbeing programs. So we go into organizations and do those. And in September, we are due to start to roll out to about 6,000 nurses, psychological boost workshops as a way for the NHS to try and support the mental health and well-being of nursing staff.
Yeah, excellent.
So I guess broadly, can you share some observations about how psychological health and safety is managed in healthcare?
I guess, like you said, there's such similarities, isn't there, across a number of industries, and I don't think healthcare is any different. What I see is a huge amount of variation. There's some pockets that are doing it really well, and then others less well. So some organizations have good intentions, but they don't necessarily invest in the resources and the infrastructure and the policies that are needed to really embed mental health and well-being and psychological health into their organization. So, I think the bugbear that always sticks in my mind from what staff say is, Jan, I'm sent an email about drink more water. We can't even get protected break times, So I think then what that serves to do is it's very disingenuous. So that also then impacts on building staff resentment and not feeling valued and respected within their organization. Whereas I think there are some teams where psychological safety is truly embedded into the organization. So they feel safe and are encouraged to step up and say, I'm feeling like my mental health isn't as it should be. And there are resources and support mechanisms in place to not only prevent it, but also address it once it's there.
Okay, so you got a pretty broad range then from companies who are doing quite well and getting into that preventative space, and then companies who are still really putting all of the emphasis on individuals managing the hazards that they're exposed to and not actually doing anything to address the hazards themselves.
Yeah, absolutely. And as you say, I think that's not exclusive to healthcare. I think that's across a number of industries.
Certainly our experience. Yep.
Yeah, no, I've had a few questions over LinkedIn direct messages lately around, can you give us an example of an industry that's doing this really well? But I think it's like what you've observed in healthcare. It's all pockets. Like there's, even teams within large organizations that are doing it quite well without the whole organization doing it, let alone an industry that is doing this really well. So it'd be great to share some examples. Maybe some of our listeners can direct message me over LinkedIn and let me know if they think an industry is doing it particularly well. But I'm yet to see even a whole company do it well, let alone an industry.
Yeah. Yeah. No.
I guess I just, work in the aviation sector, so the most highly regulated sector as well. What we've seen now is since the pandemic and a lot of pilots and staff returning to work is there's less reporting of incidents, so you can see how in some of those organizations, psychological safety is really reduced actually because people are fearful of their jobs. So yeah, you can see it across a number of industries for sure.
Yeah, I've had a few conversations with aviation psychologists offline, and then we've had people like Paul Cullen and Joan Cahill on who can talk with a bit of expertise about aviation psychology. No doubt you know them well.
Yeah,
and it's funny, right? Because human factors as a discipline within aviation is huge, but psychological health and safety or psychosocial risk management probably isn't as far advanced as what it needs to be in aviation. Obviously, been a bit of work in this space since the German wings disaster, but still
probably not the right focus of work though, from what we've heard.
Hasn't gotten down to the systemic risk management kind of work-related factors perspective.
And I mean, that's quite interesting, I think, because if you think about, you know, where the human factors discipline was born, you know, a lot of it does come out of those early days of aviation and, you know, during the war, just reducing the number of planes that were crashing because pilots were flicking the wrong toggle. You know, so a lot of that is really grounded in engineering.
Ergonomics.
So that probably has quite a lot to do with it as well, that there's that level of comfort and familiarity with engineering concepts and engineering control measures. And then when we're talking about psychological health and safety, it's a sort of completely different discipline.
Although in saying that, the aviation industry has really embraced fatigue risk management, which has a lot of similarities with psychological health and safety, as we've spoken about on the podcast.
And I've sort of done the crew resource management stuff as well. So there's, I guess, willingness to move into more behavioural type of interventions.
Okay, well, look, listeners, those who are interested in finding an industry that's doing it well, we can't give you one, but we believe aviation should be leading the way in this space.
Well, pick an industry; they should all be leading the way.
Yes,
we're all people. We're all exposed to psychological hazards. Any place that employs people should be doing this.
Yeah. So basically, we just need AI to take over the world, and then we won't need to worry about psychological health and safety anymore.
Well, we just become human batteries and live in the matrix.
Yeah, doesn't do bad. All right, sorry, bit of a tangent there. Back to healthcare. When we think about psychosocial hazards, you know, healthcare workers do come to mind, particularly in light of the pandemic. Can you share some of the more significant psychosocial hazards that would be experienced by healthcare workers on a day-to-day basis?
Yeah, and I think that's important to highlight. You know, it's great actually that the pandemic has shone a light on mental health of staff in healthcare. However, it's also, I guess, they were on their knees before the pandemic hit. You know, a lot of them were already suffering. It's not just a new thing. And so I think it's got worse. A lot of what staff are experiencing and a lot of the evidence and research that is coming out now is higher levels of PTSD, moral injury, burnout. And look, it's not saying that every single healthcare worker is experiencing these things, but I think what is more global across healthcare is that they're exhausted, that they aren't getting a break. You know, in the UK, here the pandemic is, we're now out of lockdown, we're easing a huge amount of measures and restrictions. And while that's understandably great for many people, I think the other side that is probably hidden is the impact of mental well-being on staff. And so in that, we're also seeing a lot of evidence coming out around an increase in the maladaptive coping strategies that they do. So increase in alcohol use, thoughts of suicide, and suicidality. So I think that's also another side that is less publicized, I guess. And in the absence of addressing why staff are burnt out, why staff are experiencing trauma and moral injury and stress, not just on the individual level, but on that organization system level, then I have grave concerns how the next year or two is going to play out for staff, because a huge amount of them are wanting to leave their profession or just don't feel able to work.
Yeah. So what you've talked about there is, I guess, the symptoms, or, what has been the response to the exposure of psychosocial hazards. But what would be the specific workplace stresses? What are the things that kind of contribute to this burnout experience by our healthcare workers?
I think things like not having protected breaks, so if we go to just meeting staff's basic needs, what you'll hear is some of them have worked full shift, not having had anything to drink, not having had anything to eat. The fact that they don't have flexible working, so they're not having any kind of work-life balance. And the exhaustion that comes with that, but also what comes with that is that they don't have that social support out of work to be able to support them either. The workplace bullying is a huge, certainly within some pockets of and specialisms of healthcare more than others. And I think how that plays out is a huge amount of anxiety then that staff feel, and they don't know what to do with it. So that civility in the workplace is massively lost, and they're not working in psychologically safe spaces.
Yeah, no, interesting. So, I mean, it is pretty similar to what we find across industries, those kind of things like lack of work-life balance, lack of control over flexibility of working hours, and so on. Bullying, harassment, these are all common psych hazards.
Yeah.
Right? Yeah. So healthcare, though, obviously have additional work-related stresses, obviously related more to health and the pandemic and that sort of thing as well, which we'll get to, I think, in a later question.
Yeah, I think there's probably an additional element to that where where you are in healthcare or in those types of caregiving professions, where you've gone into that profession because you feel a calling. So I think there's potentially that sense of obligation to the community, to their patients, to sort of stick it out because, they're being in that situation, working in that environment, they can see the need for the work that they're doing, and they can see the consequences, the very immediate consequences to the patients if they choose to leave that working situation. So I think there's a real a moral dilemma there for people who are in those caring professions that maybe isn't as significant for people, who engineers, for example.
Yeah. So you see something similar in education, right? Teachers putting the needs of their students, or going, well, look, I can't practice self-care at the moment because, I have a need to, teach these kids and bring them along. So putting the needs of others over others, I guess, is over themselves is a key psychosocial hazard in these helping professions.
Yeah, and I think, the training, the financial investment, the personal sacrifices that they've made to then decide that they're not going to pursue that career, that's a huge decision, right, for anybody who's pursued a career. But I think when you have a huge amount of debt that you still haven't paid off, you're not going to get paid off for a long time. I think many of them feel trapped. And when you, in all of your training, you are there to provide care irrespective of culture, background, religion. And actually, when you get into the job, you realize what you're trained to do, and that sort of moral, ethical code. Actually, the organization isn't set up to enable you to practice that because of lack of resources or institutional issues that are happening. That is where we see that moral distress and those moral injuries come to fruition.
Interesting.
So you did say that you've seen some examples of workplaces that are doing some good, proactive, innovative work in this area. Can you share some examples or some case studies with us?
Yeah, so I mean, I think what was great to see actually over the pandemic was a lot of this came out because people were more open to, right, look, we need to be able to share, we need to hear what's actually happening in other organizations. So it's interesting you say innovative. I didn't really see a huge amount of innovation. I seen that staff were getting some of their basic needs met. So, you know, for example, there was somebody that was there allocated to ensure that everyone got a break. There was actually what I did hear a lot, what organizations were doing is they created a room where staff could go, so just off the ward where they could go and just take 10, 15 minutes to chill out. And in that, some of them crowdfunded and got a massage chair. Some of them got, like, you know, different things that they could put in there that was just totally away from work. And so, yeah, others then set up a buddy system. So when students were being asked to step up, or people who were retired were also coming, there is that buddy system that was in place. But I think the part of the project that we're rolling out now in September, I guess I see that as a really great way. So it started off professional midwifery advocates. So they get a certain amount of time each month. There's 800 roughly across England. They get a allocated time each month to basically ensure the well-being of their colleagues. So they can provide safe spaces. They have a huge amount of training. They can refer on and signpost on. So NHS England is now rolling this initiative out across 6,000 nurses across different specialisms, so ICU nurses, community, mental health, older adults. So I see that as, you know, that's a real initiative to be able to go out and recognise that staff need support.
Yeah, definitely. And I guess a really important field for that at the moment as well. Given what's happened in the last 18 months. And I guess there's, we know that people can kind of lift their performance and extend themselves for shorter periods of time to meet demand, but then that drops off pretty quickly after a point. So I think we're well and truly past that point now. It wasn't a sprint. It's a marathon, and we're still not finished.
Yeah, absolutely.
Now, Jen, you mentioned before about some of the consequences of a psychologically unhealthy work environment for healthcare workers, so leading to burnout and cynicism and all the rest. What can healthcare organisations do, do you believe, to prevent healthcare workers getting to that point? How do they prevent burnout and distress?
I think it starts actually a step before that in universities and trainees while they're on placement, where they can provide almost like the education of mental health and well-being and help them recognize what some of the signs are, not only in themselves, but also their colleagues as well. For me, it always comes back to creating a psychologically safe space. And so when staff are in a space where they feel safe enough to speak up, then that's something that they can do to really prevent part of their mental health deteriorating. But I think it's flexible working, so that they can really get that work-life balance. I was sharing earlier about the impact of moral injury. Do you know, some of the cases that I've heard over the years where staff are massively torn because they're having to make a decision about which equipment to use with which patient, and there's limited equipment. So adequate resources as well. And I think understanding exactly what psychological health is, you know, and psychological safety. I think there's a huge myth around it in some organizations. You know, people think it's really soft, really fluffy stuff. And yet a lot of the public inquiries into some organization failures have cited workplace culture as, you know, one of the key determinant factors in that. So it's really, really understanding that, and also embedding civility in the workplace. What I often say to organizations is, you don't have to feel kind to be kind. You know, kindness is an act, the same way civility can be an act. But if that's embedded in policies, you know, I don't know, within 5 foot, you greet somebody, you hold the door open, you know, if these kinds of things are embedded into the policies as well, so that there then creates a culture in that preventative way. And also that there are screenings in place, screening where people who are able to reach out and say, and managers are able to then say, look, how are you feeling? This is what I've noticed. And there's adequate signposting, and that the services are there, because it's great if you can signpost, but if the service isn't there, then that's really difficult, and that staff don't have to go to those services in their own time, that's part of their shift.
Yeah, it's quite a range of things that you spoke about there, right? You know, giving people control over the flexibility of working hours, or, you know, like you say, just that protected break time, or having a space that they can go to when they just need to disconnect from work and go, hey, look, I've just had a really difficult patient, or something like that. I just need some chill time for 10 minutes, get on that massage chair, you know, just feel like a human again for a little bit before going back out into the workplace, having that flexibility. Having just positive relationships in the workplace rather than that incivility, as you say, which obviously is a step before bullying and harassment. But even, like you say, just meeting basic needs. I remember when looking at burnout around healthcare workers when the pandemic hit here in Australia, there was just reports about people not having access to PPE. And if we look at ISO 45003, for example, they have a whole section there on physical safety and how that impacts on work-related stress and mental health outcomes. And so just having basic needs met is so important, right?
Absolutely. Yeah, and I think it's massively underrated. Do you know, it's a conversation that perhaps, I guess, mental health and psychological safety is the much bigger picture. But when I hear staff, you know, share with me that they weren't able to get to the toilet, and the humiliation of that, do you know, we're fundamentally, you know, not meeting human beings' basic needs. And the irony is, we're in healthcare. You know, we're supposed to, Joelle, as you were saying, we're supposed to be caring for one another. And so that has a fundamental impact on staff.
Absolutely.
Yeah, we were just having a little bit of a eye roll earlier today about a particular company that has been in the media for some of its employees needing to wee into bottles because they don't have time for a toilet break, but yet they've installed mindfulness pods around the workplace for people to go and have a meditation or something. So I don't know, maybe they'd be better off putting toilets in there.
Absolutely.
Or allowing people the autonomy to choose when to take a toilet break.
Indeed.
Yeah.
Indeed. Yeah. But, if
Yeah.
you're calling it a mindfulness break and it's actually a wee break, maybe that's a way to
Maybe they should install toilets within the mindfulness rooms. Is that what you're saying?
That's what I'm saying. Yeah.
Yeah. Like a long drop. Yeah.
Well, that's a bit stinky. Unhelpful, Jason.
Sorry. I'll stop giving ideas.
So you spoke a little bit there about leaders. Jan, can you talk a little bit more about the role of leadership in healthcare as far as protecting the psychological health and safety of frontline workers?
Yeah, I mean, I think leaders are the linchpin in it, because to ensure that it's embedded within the organization, for me, leadership is all about relationships. And so this requires leaders to be able to develop those relationships, with people across every level of the organization. But I think it's also leaders, I guess, I mean, I want to say being bold, but it doesn't sound like it's a bold move. But I think for some organizations it is, which is listening to their staff. Not listening already having thought of what the outcome is going to be, but actually really listening to what the staff needs are and what the staff think that needs to be put in place to try and meet those needs. And I think for a lot of organizations, that just doesn't happen. Some organizations it does, but when I'm working with leaders and they share with me, I don't have time to do this stuff. It's like, right, 3 times a week, let's factor into your schedule a walkabout, where you just are down there walking about round so that you're visible, you're present, you can start to build up those relationships and start to have some of those, I guess, informal discussions and get the feel of what it's like. Now, hearing it from the staff when they're like, oh, the chief exec is down, something must be going off, but actually after a while, what you hear is when they see that their leader is there, genuine, with integrity, open to truly listening to what they're saying, they're really opening to because they're desperate for change. They don't believe necessarily that the change will happen, but they're definitely desperate for the change to happen. And I think, it's really, really what I hear a lot from staff is we can't get buy-in from leaders to do the mental health, look, we really love what you're saying about the mental health in the workplace and psych safety, but we just can't get buy-in. And my response to them is probably twofold. One is, you can take a case study within the organization and really build a case study on how it has worked, and then use that to develop a business case for the leader. But also you can create it within your team. That you can have some pockets of it where you can develop that, build trust within one another, and that can be a more supportive environment. And so, I mean, I'm holding just a report that came out a couple of years ago in 2019 about 4.6 billion pound per year, or dollars per year, is the cost of physician burnout. And so I guess patient safety and the mental health of staff aren't separate things. They are 2 sides of the same coin. And I think when leaders can really, really understand that and surround themselves with people who are able to then help them embed that into the organization and change the culture, that's brilliant. That's really great when they're able to do that.
Yeah, that's a really important point. I think coupling, the mental health of caregivers to patient safety outcomes, and I guess what we've found is that where we can demonstrate a connection between employee mental health and then organizational safety outcomes, we tend to get the attention of senior management a lot more quickly when they're thinking that it's going to impact on their safety metrics. That they tend to be a lot more interested and a lot more willing to make some commitments that way. So I think the more that we can make those connections between safety outcomes and mental health, the more quickly we'll be able to get meaningful action in this space.
Yeah, we missed out an opportunity recently to participate with a local health department around looking at burnout, psychological health and safety, and patient safety outcomes. So we are talking a lot this month around getting top management support and creating the business case and aligning the workplace mental health, what would you say, advocacy with business metrics, or what is actually important to the board and top management. And obviously in healthcare, aligning it to patient safety is a big one.
I mean, I think the worrying thing is when it comes to patient safety, right, it's the safety of patients. And so we don't want to get to a place where patients are either significantly injured or they have died as a result for the organization to listen, you know. So I guess in that more holistic organization way, you asked earlier, Jason, about putting things in place to prevent. It's trying to safeguard that we don't have to get to that place before things can change. And that's the worrying thing.
Yeah. I mean, if companies that employ healthcare workers don't at least care about their employees enough to improve business practices to look after their well-being, then they at least should care about their patients' well-being, and that can be protected by looking after their employees.
Yeah, absolutely.
Yep. Whatever angle we need to take to get the message through, I think is basically the strategy. So Jane, you spoke a little bit earlier about sort of the impact that COVID has had on healthcare providers. So what do they need now to help them recover from the state that they're in at the moment?
I'm not sure if you have seen the latest in the UK, but there has been a huge uproar, understandably, about the pay rise. The pay rise, I say in inverted commas, for healthcare workers, and how they feel valued. Do you know that they feel valued there was a huge amount of appreciation, understandably, for a lot of healthcare staff from the public. And I think part of this now is that that's recognised by organisations. So there is things that are put in place, like mental health, preventative measures, but also resources that are put in place for staff to be able to access help. And I know that is happening in quite a lot of organisations. Staff need time off. They need, it's some of the stuff that we've already talked about. It's the resources that they need to enable them to do their job. And for many staff, that's just not coming.
I guess we talk quite a lot about stress being cumulative, and that, the more, regardless of where it's coming from, the more that you're dealing with, the harder it gets to deal with every new stressor that comes along. I sort of think about it as almost like you've got a backpack full of rocks, and it doesn't matter who's putting the rocks in there, you're still carrying those rocks around. So, whatever your organisation can do to take some rocks out or avoid adding extra rocks in is going to be a benefit, even if you're still just dealing with horrors outside of work. If you can not have work adding to that, then that's going to be a positive.
Yeah, like, I mean, I spoke to uh, um, a medic a couple of weeks ago, and he was sharing with me that he hadn't had any time off at all in 11 months. And he had a week's annual leave planned. And the day that he was due to go on annual leave, all annual leave was cancelled. Do you know? And it's understandably the organization is under huge pressure, but it's also trying to support staff to have time off. They are exhausted.
Yeah, and it's such, to go back to the patient safety point again, if your staff are exhausted, you're going to have poor patient safety outcomes. There's no question about that.
Absolutely. If staff are hungry,
Mm.
do you know, we know this, right? This isn't new information. However, I think it's trying to make that link between the patient safety and also the mental health and well-being of the staff. Do you know, the levels of presenteeism that are here right now are huge.
Yeah, well, Jan, you've painted a quite disturbing picture of healthcare and psychological health and safety, and obviously there's lots of room for improvement. So what are your hopes for the future of workplace mental health, particularly as it relates to healthcare?
I hope it hasn't been too much doom and gloom. I guess it's maybe symptomatic of how things are right now, and we're having much more open conversations and honest conversations about it. But what I would say is I am a total purveyor of hope. And my hope, I guess, is that the tragedy, particularly over the last 18 months, that many families and people have experienced, this could be a really great opportunity. Do you know, it could be a really great opportunity to turn something really tragic into something really positive. Do you know, there are more conversations happening in organizations now about mental health and psychological safety. There is more recognition that staff need breaks, that they're burnt out, that they're traumatized. And I guess for me, I really push that workplaces in healthcare not only can be healthy places, but they can be ones that improve your mental health. And that would be great.
Yeah, absolutely.
Imagine that, a workplace that improved your mental health.
How attractive.
Well, I like to think
Absolutely.
that with the amount of rocks in your backpack, Joelle, people diagnostics helps to take some of those out.
You don't add too many rocks to my backpack, Jason. Thank you. I appreciate that. So Jan, I guess you're talking about opportunities. So thinking about potentially people who are already working in healthcare who think that this is a really valuable area that they'd like to contribute to in terms of psychological health and safety in the field. Do you have any advice for them?
I guess I think it is a career that can be personally and professionally really challenging at times. And so I guess spending time truly knowing why you want to work in this field and what your values are, because I think they'll be your compass and they'll guide you through the tougher times, because when you get to do what you love to do every day, it can be immensely fulfilling and really fun. That's it. Yeah.
Wonderful advice. Thank you, Jan.
Well, Jan, it's been a terrific conversation. Like I said, a little bit gloomy, but there is some rays of hope there. And at least there's lots of room for improvement for the healthcare industry as a whole. So look, thank you very much for lending your expertise to this episode of the podcast, and for being such a great person.
Thanks for having me.
Yeah, terrific. Well, listeners, that brings us to the end of this episode. Don't forget that we do record these over Zoom. So if you prefer to watch the video, like our friend Vince does, then you can check that out on the Flourish DX YouTube page versus the podcast. We also do take the little snippets out of these clips, which we share on the Flourish DX LinkedIn page. So do check that out. And while you're over there on LinkedIn, then Joelle and I are on there. And Jen, you're on LinkedIn too, I take it. So
yes, I am.
If you have any questions and want to reach out to Healthy You or see how Jen can assist with her background and her team at Healthy You, then please reach out to her over LinkedIn as well. And that brings us to the end. So thank you, listeners, and we'll catch you next episode.